Good afternoon, everyone, and Happy New Year. Welcome to today's webinar, Vapes, Weed, Mental Health in Teens, provided through a collaboration between the Pennsylvania Medical Home Initiative, which is a program of the Pennsylvania chapter of the American Academy of Pediatrics and funded by the Pennsylvania Department of Health. This webinar, led by Dr. Offit, aims to gain an understanding of how and why teens use e-cigarettes and JUULS and why this is a problem. To understand why legalization of marijuana should not be understood to vouch for its safety, especially in our teens, and to learn how exposure to nicotine or marijuana in the teen years increases risk of lifelong addiction. My name is Dr. Renee Turchi, and I'm a pediatrician at St. Christopher's Hospital for Children and medical director of the Pennsylvania Medical Home Initiative. This webinar is being recorded, and this recording will be available on both the Pennsylvania Medical Home Initiative's website as well as posted on the University of Pittsburgh Internet-Based Studies and Education and Research website. For CME purposes, please be advised that I have no disclosures. Dr. Offit discloses that she was a participant in the Advancing Adolescent Health Forum in 2018 as a consultant for Pfizer. However, this will not influence the presentation today. Please note that the information presented in this webinar is educational in nature and does not necessarily represent the views or policies of the Pennsylvania chapter of the American Academy of Pediatrics nor its funders. Now please allow me to introduce Dr. Laura Offit. Dr. Offit earned her BA from Columbia University in New York City and her MD from Northwestern University in Chicago. She came to the Philadelphia area to do her residency in internal medicine at Thomas Jefferson, later joining their faculty. After leaving academia, Dr. Offit worked in clinical research, drug development, and medical consulting. Building upon this varied professional medical experience, Dr. Offit has created a digital teen health resource called Real Talk with Dr. Offit, through which accurate, understandable, and honest answers to teen health questions are shared. A passionate advocate for teens and their health, Dr. Offit founded Global Teen Health Week, first celebrated statewide here in Pennsylvania in 2016 and expanding to a global observance by 2018. Dr. Offit is an invited fellow of the American College of Physicians, a member of the Society for Adolescent Health and Medicine, and a member of the Pennsylvania Medical Society. She's on the board of directors of the National Alliance to Advance Adolescent Health and is a member of the Unity Consortium. When she's not working with teens or answering their health questions, Dr. Offit cares for uninsured patients as a volunteer physician at Community Volunteers in Medicine in Westchester. The mother of two adolescents herself, one in high school and one in college, Dr. Offit believes that when teens are armed with accurate and unbiased medical information and encouraged to be part of discussions about health issues, they are in a better position to make healthy decisions and ultimately to become healthy teens. We are delighted to have Dr. Offit present on this timely and important topic for primary care clinicians. Dr. Offit, thank you for being with us today, and at this time, please begin your presentation.
Dr. Turchi and Eileen, thank you both so much for the invitation and for the kind introduction. I'm absolutely thrilled to be here today to talk with all of you, and I know that there will be opportunity for Q&A, and I'm not sure how the process is, but it looks like there's a Q&A box here, so if there's questions as we go along, feel free to use that, and I'll try to address the questions that I can. When I gave a similar version of this talk about a year ago, this slide was pushed way further down into the presentation, but I think probably everyone participating today has heard a lot about JUULS in the news recently and how the company itself has been strongly suggested to take a lot of actions to decrease the appeal of its product to teens. So I thought I would just kind of start almost in the middle of this conversation with a picture of what a JUUL is and a quote that I think really sums up a large part of the problem that we're facing with our young people and electronic cigarettes. So this is a quote from an 18-year-old. It's pretty typical. You know, I know it's an e-cigarette, but I don't like to call it that because you can JUUL and not be addicted to nicotine. And this is, I think, one of the critical problems is that so many young people have, and I'm hoping I can say now in past tense had, no idea that nicotine actually was in the JUUL pods. I gave a similar talk to a high school in Ohio last year. They were very concerned. The administration was really concerned about the use of electronic cigarettes amongst their students, and they were trying a number of different methods to try and decrease use and to educate their students. And so before I went, I really wanted to know what the students themselves thought. So I put together a survey that I had put up on my website so they could answer a few questions for me anonymously, because as with pretty much every risk behavior, I really want to know why it is teens are doing these things. So we got good response with the survey. I actually sent it out again through my social media before this talk because I was curious if anything had changed. But you can see here on this slide, when I asked teens what is the appeal for e-cigarettes? Because I get some of it, but I really don't get the breadth of the appeal. And so here are some of the answers to that question. The technology is cool. It's like when the iPod came out and everyone started listening to music that way. It's clean. All my friends do it. I can do it at home and my parents don't know. It's just vapor. It's funny to sneak it in class. I like the rush it gives me. It's social. And I think this snapshot of a couple of responses to that question illustrates a lot of the power behind e-cigarettes. Part of it is the classic teen desire to be sneaky and pull the wool over adults' eyes. Part of it is a misunderstanding that vapor is harmless, and so there is no risk involved. You see a little bit of hint about the nicotine addiction and the good feeling that nicotine is giving young people with I like the rush it gives me. And it's social. And the social aspect is probably one of the biggest components with e-cigarette use in young people. This certainly has not gone unnoticed. I do think that the FDA and the FTC have been a little bit slow in trying to address this problem with the rapid increase and uptake in e-cigarette use by young people, but thankfully that is starting to shift. A large reason that this is beginning to shift pretty rapidly is linked to a study that is done every year called the Monitoring the Future survey. And many of you may have seen some of the news headlines at the end of December, early January about these new findings showing a rapid increase in vaping and e-cigarette use and juuling use in teens, and even just comparing 2017 to 2018, there's been a dramatic increase. And so this has triggered a lot of statements made by the Commissioner of the FDA, the Surgeon General, and a large number of government and federal health organizations. So what exactly is this survey? It's a survey that's been done since 1975, and it measures drug, alcohol, and cigarette use and attitudes that adolescents have about the use of these substances nationwide. And what students do is they report their drug use behaviors across 3 time periods in their lifetime, over the past year, and in the past month. And you can see that about 45,000 students from almost 400 schools participated in last year's survey. This is actually an increase from 2017, which is great because it reflects more of the young people that we interact with. So I'm going to go through some of the findings of that to really drive home why this is such a big concern. I do believe I'm preaching to the choir here, but these are some of the things that I highlight to parents and to teens themselves so that they can really have a better understanding that this is a problem. So for the 2018 data, you will be shocked to see that almost 40% of 12th graders have vaped in the past year. And when you look over to the graph on the right, one of the questions is, what do teens say they're vaping? And you'll see on the bottom, they could answer nicotine, marijuana, or hash oil, or just flavoring. Now, one of the things that I like to emphasize here is this is what teens say they are vaping. And so if you think back to that quote that I put up on the very first slide about I can JUUL because there's no nicotine in it, this is just what teens think is in the e-liquid or e-juice that they're vaping. So this is one problem. It's interesting to see that a fair number of teens, and it increases as ages go on, know that they're vaping nicotine. When we compare 2018 to 2017, you'll see the jump from 27.8% to 37.3%, almost a 10% increase in 12th graders saying that in the past year that they had used vaping devices. It's also a 10% increase in 10th graders. An increase as well in 8th graders, but not quite as substantial, but still definitely concerning. And again, it's this question of what do the teens think that they are vaping. This is an interesting graph, too, because it specifically addresses teens vaping nicotine or marijuana. So teens knowingly putting a substance in their e-cigarette or using a JUUL specifically to vape a substance, either marijuana or nicotine. And if you look at this graph, you can see in the past month, from 2017 to 2018, those rates are increasing. One thing that I am curious about is with the self-reported use of vaping nicotine, is that because there is awareness that different products have nicotine in it, whereas before they were unaware, or if this is a straight-up increase in deliberate vaping of nicotine, or a combination of both. I would guess it's probably the latter. Now, certainly a major component that is contributing to this is advertising. You know, there are so many teens in the country that it's almost like the holy grail of advertisers and businesses to try to get teens to part with their money. And so you can see in this chart, this was from last year's findings from the Monitoring the Future study. I could not find updated figures on this, but at that time, this was looking at data from before 2015, 70% of teens were exposed to ads about e-cigarettes. So we can all assume that that figure has only gone up substantially in the past couple years. I mean, advertising is everywhere. A year ago, I went to New York over the holiday week, and you go to Times Square and you look up and there's a huge advertisement for e-cigarettes, a brand called Enjoy, and their slogan is, "It's fun." So that kind of sums up part of the problem there. But then in print, we're seeing the same thing. I pulled this example out. There is an organization at Stanford that does spectacular work pulling together advertising materials around tobacco, e-cigarettes, and marijuana. And one of the ways I talk with young people about this topic is, since part of the appeal is sneaking something behind adults' backs or in school or at home, I try to help them understand that what's happening is that adults are trying to trick them into spending their money on these products. And one of the things that I explain is that although selling of tobacco-based products has been limited in terms of advertising for quite a few years now, thankfully, that was not always the case. And so what the e-cigarette companies are doing now is they're using the same playbook that tobacco companies use to recruit new and young smokers, and they apply those messages to e-cigarettes. So one of the big themes, and we talked about this in the little survey that I talked about at the beginning, is the social aspect is very important. So you can see the Salem cigarette ad here and the blue electronic cigarette ad here. They're almost indistinguishable. The message is definitely the same, and it emphasizes a social aspect around using e-cigarettes. There's many more examples like this, talking about patriotism or talking about sex appeal, whatever messaging around selling cigarettes that has been proven to work with young people in the past. That exact playbook is being used by the e-cigarette companies. And we haven't even started talking about the internet. And again, this data is old, but if you look at it, almost half of high school students were exposed to internet advertising around e-cigarettes. And we all know adolescents are walking around with portable computers in their pockets almost all the time, and they are barraged by advertising on all their social media platforms, on websites, with the cookies that are tracked, which will select to promote certain products to them. They are barraged with internet advertising. This is a huge problem, and I know that this is a moving target, but as of 2016, even though it has been illegal to directly advertise to youth or minors e-cigarettes, there is a loophole with internet advertising. So online advertising isn't regulated in the same way that print or radio or TV advertising is regulated. And there's a gap there, and there has been some activity in this space to put some regulations in place, but there is a loophole and an extension that is in place till 2020 or 2021, but this is one area that the FDA and the federal FTC are looking into modifying, because obviously it's a huge gap, and that's where teens are getting exposed to most of the advertising that is geared directly towards them. Now, we talk about clickbait. So you can see the ad, and there can be a link, but do teens actually click on the link? But yes, this is, again, from 2013, 2014, but nearly 12% of adolescents at that time had engaged with online tobacco marketing, and we know that actively engaging with the marketing and with online advertising increases use. So that's one piece of how teens are getting pulled into the e-cigarette space. The other place is with flavors, and we probably all recall that in 2009 it became illegal to promote tobacco products with flavors other than menthol at all. They may exist, but promoting them at all is illegal. But that actually had not been the case for e-cigarettes. But that is, again, being revisited because it's well described that fruity and fun flavors are very appealing to young people and to children, and that is a huge problem. So talking about the internet, we can't talk about promotion on the internet without talking about social media. And many companies, not just e-cigarette companies, they have a social media plan to promote their product. And so JUUL is the company that has gotten the most attention recently, and there's been a lot of publication about what some of their advertising strategy had been online. And social media, is a platform that we're all trying to use to share our messages, and one of the ways that e-cigarette companies and JUUL in particular has used social media to help promote their products is by seeing who are different social media influencers that appeal to teens and reaching out to them and seeing, will you test our product and create a blog post or an Instagram picture or something like that, and every time you do that, we'll pay you a certain amount of money. This campaign has been shut down, but in many ways the damage has been done because social media, part of the beauty or the danger of it, depending on what message we're trying to get across, is a company or an organization can put a message out, but then it takes on a life of its own. So even if the companies themselves are not actively using social media to promote their product, you can bet that the young people and older people as well are using their social media and inadvertently and at no cost to the company continuing to promote the product. I mean, the headline of this article has a hashtag in it, and if you go to any social media platform and punch in the hashtag, you're going to see a ton of posts, most of which have nothing or are not directly connected to the company. I grabbed a few screenshots about a year ago just to give you a sense of the different types of flavors that are on the market for e-juice or e-liquid or pods or the JUUL pods, just to give you a sense. And there's things like creme brulee and cool cucumber and fruit punch and marvelous mango. So you can see that this is a problem. In the eBay screenshot up at the left, eBay was actually asked by the FDA to take down selling of fruit-flavored pods from their website. And I did take a peek to see if that was still working, and it does appear that those things are down. So it's good. I think that the problems are being addressed where they are, but there is certainly a lot of work to be done. So a couple specific things that the FDA commissioner is trying to do in direct response to the e-cigarette trends that have been seen in this Monitoring the Future study. One is that they're trying to remove products that are marketed to children or are appealing to youth. And so some marketing components can be popular children's cartoon or animated characters, or the name of the product is something that's inspired by brands of candy or soda that they like. A while ago, they had already targeted e-liquid manufacturers whose products actually looked like juice boxes or lollipops or other foods because, obviously linking a nicotine product or a vaping product to a candy or juice that is so appealing to very young children is a very dangerous thing. I'm going to shift gears here and talk a little bit about how vaporizers work. They're all a little bit different, but they generally function in the same way. So there's a mouthpiece. There is a space where the cartridge or pod or e-juice or e-liquid gets put into place. There's a heater, and there's an atomizer, and then at the end is a battery. And when the user inhales on the mouthpiece, that turns on the battery, which then heats up the heater and then proceeds to vaporize that liquid that's in the capsule. Now, JUULS really operate the same way. How do you charge up the battery? It's different depending on the device. The way that JUULS batteries are charged is you actually plug in a small, sort of like a USB drive, but you plug in this magnetic charger right into a USB port, and then you attach the JUUL device into it, and it charges in an hour. I honestly don't hear too much about this, but I figured I would include a slide just to make everyone aware. There is another way that people use e-cigarettes, and it's called dripping. And rather than using the cartridge and having the vapor go through the cartridge and through the mouthpiece, people open up the cartridges or use the e-juice directly and drop it right onto the hot coils of the atomizer. And the reasons that have been shared for this is that there's stronger flavor, a bigger nicotine rush, which is obviously problematic, and thicker smoke as well. And we probably have seen pictures, people talk about vape tricks and things like that, and if you search that on any social media, if you plug in vape tricks as a hashtag for Instagram, for instance, you'll see tons of pictures. A lot of the young people I've talked to kind of laugh about that because they said, well, part of the appeal of vaping is there's no smoke, so you can sneak it. So I suspect that this dripping approach is how the smoke is generated for some of the vape tricks. So problems, by doing it this way, the young person is exposed to higher levels of nicotine than if just using it the regular way, and the regular way is bad enough. And also there's exposure to harmful toxins such as formaldehyde and acetaldehyde, which actually exist in regular vapor as well and are well known to cause cancer. So to kind of go back to this concept of what exactly do teens inhale, teens are self-reporting different things that they're inhaling, but that's what they know or believe. And one of the things I wanted to highlight here, which was really highlighted more in last year's findings than this year's, is that e-cigarette companies are not required to fully disclose all of the ingredients in the e-liquid or the e-juice. So even if a teen is trying, and I'm putting air quotes here, but you can't see me gesturing that way, if they're really trying to make a healthier decision because they choose to vape, they may not have all the information at hand, and so they may be making a decision assuming that there is, quote, nothing in the vapor, when in reality there could be nicotine, for instance. So we've probably all heard this argument, and I hear this argument as much from adults as I do from young people, and I would imagine that's probably true for many of you. This whole concept of, but it's just vapor. So it's not just vapor, and there's a couple different things that everyone should be aware of. One is the metal coils themselves. When they're heated, they release small metal flakes, and then obviously everything is aerosolized, and when it's inhaled, the metal flakes go deep into the lungs. As people get exposed to more and more nicotine, one of the things that can happen is that deeper inhalations are taken or bigger draws are taken on the device, and that is a very effective way to distribute these small metal particles deep into the lung parenchyma. It's not surprising that it can cause airway irritability and asthma-like symptoms, and we've been seeing more and more case reports in the literature about things like popcorn lung or pulmonary pathology that results directly because of chronic inflammation. The second piece that everyone needs to be aware of is that most e-liquid has propylene glycol and glycerol, and when those are heated, they break down into formaldehyde and acetaldehyde, which are known carcinogens. And an argument that is often put out there is, well, cigarettes have them too, so it's really no different. But actually, because of the way the e-liquid is heated, the chemical reaction is much more efficient in converting these products into formaldehyde, so that there's 7 times more formaldehyde in vapor than in cigarette smoke. One of the problems here is that it's very difficult to win an argument on safety comparing e-cigarettes to cigarettes. So although I will explain in more laypeople terms these findings with young people, I tell them right away that we have about 150 years of cigarette experience, and that safety has been well defined, and we only have about 10 years of e-cigarette experience. So as we try to help young people understand that it's not in their interest to vape, I think it's important to just acknowledge that you can't compare safety to safety, because we're at a completely different place in the life cycle with this product than we are with cigarettes and tobacco products. So let's talk a little bit about nicotine. I will say when I started learning more and more about electronic cigarettes, I was really surprised to see how much nicotine is in each cartridge or JUUL pod or the like. Roughly a pack of cigarettes is in each pod or each typical e-cigarette cartridge. So what is a little tiny amount of liquid carries a whole lot of nicotine. And, you know, this what strength should I choose? This is an interesting table. It helps, you know, new users of e-cigarettes to understand how much concentration of nicotine they should get so that it's not too rough or abrasive. But if somebody really likes the mouthfeel of a big cigarette hit, then you get steered towards a higher concentration of nicotine. But if you look at that, the highest concentration that's even on that table is 1.8%. But then when you start looking at the concentration of nicotine in the JUUL pods, it's actually 5%. So a very high concentration of nicotine is in the JUUL pods. And obviously the higher the concentration, the more risk of dependence and addiction to nicotine. So going back to that original quote with this 18-year-old that thought there was no nicotine in the JUUL pod, you know, in the U.S., JUULs are capped at 5% nicotine, but interestingly, the European Union caps the nicotine content in their JUULs at 1.5%. Of course, the internet can break all of those boundaries, but one of the points that I really try to emphasize is the JUULs company does not sell a pod without nicotine. There is no just flavor pod for JUULs, and that is something that is surprising to many young people. And again, preaching to the choir, this is why we worry about nicotine at all, is that teen e-cigarette users are more likely to start smoking. And I've heard a lot of people criticize this graph that, you know, even smoking one cigarette doesn't mean they're officially starting smoking. But as kids are getting exposed to higher and higher concentrations of nicotine in electronic devices, they're going to be less averse to the noxious sensation of smoking from a tobacco-related product because they're already used to that big hit from the higher concentration of nicotine. So how can you tell if a young person is vaping? This is a question I get asked a lot, and so there's a couple clues. One is they're drinking a lot more water or other beverages because vaping can make them thirsty. If you're near them and they smell sweet like candy or chewing gum, but they're not eating anything, that could be a clue. Or they stop drinking as much caffeine as before because nicotine can make them more sensitive to caffeine. But in all honesty, I think it's really, really difficult to know if someone wants to hide that they're vaping. So I have a couple slides with pictures of different sorts of vaping devices. I mean, they honestly come in every, you know, shape, color, design. A lot of them don't look like cigarettes. They can look like pens. They can look like USB drives. You know, we talked about JUULS. This is an example of their starter pack. They have for new customers a promotional starter pack where you get the device, you get a sampling of different flavor pods. This is at a big discount. So that's what that looks like. These here on the right are the different flavor pods that get inserted into the JUUL. They can be very small. I mean, this one is, I guess that's a 50-pence piece, but it's a small coin. So you can see how small these things can be. So then the question that a lot of adults want to know is, so where are young people getting these things to begin with? And since the internet is full of answers to all sorts of questions, you can bet young people go to the internet to ask this question. And so Whisper is a website or an app where people can ask anonymous questions. So I went on this and I found this. I'm 16, how can I get a vape pen without my parents knowing? And you can see over here a bunch of helpful answers from other young people. Some people say wait 2 years, so that's nice, but other people say, buy a gift card, pay for the gift card, and then buy it online. So there's a lot of helpful information for young people. So I asked the same question in that survey that I had asked students to fill out, and these were the most common responses, from a friend at school, from a gas station or convenience store, at a vape store, or online. And the most common answer really was from a friend at school. So I keep touching back on how the FDA commissioner is now trying to take some more solid action. And so in trying to address some of the sales practices, these are a few of the things that are being proposed and requested of companies. One is to use heightened age verification for online sales. Age verification is used across a lot of social media platforms where people have to be older than 13 to be on there. The heightened age verification is supposed to ensure that people buying e-cigarette devices online are older than 21. Also, for e-cigarettes, if there are going to be flavors sold, that they'd have to be sold in person, and then that way the person would have to show an ID showing they're older than 21. But then also to escalate enforcement against retailers who illegally sell to minors. But, if you are looking here that kids are getting, vapes and e-cigarettes from gas stations or convenience stores or like the rest stop on 985, I mean, they're everywhere. It's such a huge number of organizations or places that sell e-cigarettes, it's going to be very difficult for them to do that. I compared the age verification screen from the JUUL website from 2018 to 2019. It's almost essentially the same. It just says that I'm 21 before I enter the site and I agree to have my age be verified. On a bright note, there is now here a warning that the JUULS contain nicotine, and it is a nicotine product, and nicotine is an addictive chemical. But there's not too much difference there, and I don't know how effective the age verification process is on the backside. And then again, these actions may not help much because the most common place where a young person is getting these devices is from a friend at school. So I want to segue a little bit into talking about marijuana. So it's not only nicotine that is vaped, and you can see there's a lot of online promotion and suggestions and advice about how to vape marijuana. And there's a couple different ways that the marijuana can be vaporized and inhaled. And here are a few on the side, either marijuana oils or synthetic marijuana, which you may have heard referred to as spice, wax, or herbs. They all have different concentrations, but we've seen in some of the data that there is an increase in the percentage of teens that are actually vaping marijuana. And I do think that no discussion about teen exposure to marijuana can really be had without acknowledging the change in the legal climate in all of our states. And so this is a recent update in terms of the status of legalization of marijuana across the U.S. And one of the things that really bothers me is that the entree into legalizing marijuana for recreational use has been an argument about legalizing medical marijuana, because marijuana has never been studied in the same way as say, prescription medicines or over-the-counter medicines to really define a safety profile and to prove efficacy for different indications. But since the arguments have started around medical marijuana being a useful option, and that may very well be true, but it has had this effect on the public, and in particular in youth, that all of the safety questions about marijuana have been answered. And even with all of that, the benefit outweighs the risk, and that's why medical marijuana is being legalized. And really, that is not the rationale of why it's being legalized, but it's more a stepping stone to legalization for recreational use. So I try to emphasize that point with young people by saying, just because something's legal doesn't necessarily mean it's good for you. And, this is an example. There's plenty of examples of legal things that are not good for us. So this is an interesting statistic. Teens are more likely to use marijuana than cigarettes. There's a couple caveats on this that I would point out. This talks about past month use. One thing that I have heard that many of you have heard as well from experts in the field is this line showing a decrease in cigarette smoking has had a nice steady decline because of all of the very effective actions that have been taken to decrease cigarette use among young people. However, with the introduction of e-cigarettes, we're seeing data that looks mostly like a lot of this decline has actually been undone if you put e-cigarettes and tobacco cigarettes together. So that's obviously concerning. The other thing that I think is interesting to note, and I kind of have on my list to dig a little bit further, is marijuana use looks pretty flat across the last 25 years, but I would be curious, the same analysis, like if these are like marijuana joints as opposed to, is this also including vaporized marijuana? And I suspect that this figure is not including vaporized marijuana. So I would be curious to see, is marijuana use actually increasing? Because I think for a lot of us that work with young people, our gut is telling us that it is. This figure talks about daily marijuana use. And again, this also makes the same statement that the use is steady, but I don't know how much vaporized marijuana is getting included in this. But regardless of what the denominator is, we're seeing that 6% of 12th graders are using marijuana on a daily basis. And I know all of us agree that when someone is using a substance on a daily basis, this is not experimentation and fun and social behavior. This is a warning sign for substance misuse disorder. So this whole context in which our young people are growing up and being exposed to marijuana has created this situation where they really don't perceive marijuana as having any risks or having minimal risks. And so 3 out of 4 teens really don't perceive any great risk at all from smoking pot once a month. So what I do try to do is to address some misconceptions that may surprise teens just about things in their life that would be affected. And one of them is that marijuana is one of the top 3 drugs causing addiction. And we all know that exposing a developing brain to a chemical substance enhances the risk of addiction later in life. So the younger the exposure of the adolescent brain to marijuana or any substance, alcohol, nicotine, for example, the higher the risk of addiction developing. And about 1 in 6 teens who smoke marijuana will actually go on to struggle with addiction. And teens are very surprised at this figure. Another thing that I think is important to really take the bull by the horns and address directly is this misconception that driving after smoking marijuana is not a dangerous thing. I think young people have really received the message that we don't drive drunk, you don't get in a car with a drunk person, those sorts of things. But I've heard them tell me, well, driving while drunk doesn't make any sense because, you have impaired judgment, and so then you drive too fast and you do a lot of risky things. But when you smoke weed, we're very relaxed and everything slows down, so we drive a lot more slowly, so it's not, a risk. So this is a huge problem. And so I make sure I highlight this to young people and point out to them that actually, just like driving impaired with any substance increases your risk of having an accident, Driving under the influence of marijuana doubles your risk of having a car accident. And then the third piece is that marijuana can negatively affect mental health. And I think that part of this medical marijuana discussion is one of the things that misrepresents this risk for young people, in that it can actually trigger certain illnesses or psychoses in people with risk factors, and it can precipitate anxiety symptoms. And a lot of young people talk about using marijuana to treat their stress or to manage their anxiety, and actually this is not a great plan. I don't know how many of you have heard about cannabis hyperemesis syndrome, but this is something that emergency rooms are seeing an increased number of, and I try to let all people working with adolescents be aware that this exists, because GI complaints are common in all people and often in children and adolescents. But what this is vomiting in patients who use cannabis chronically and almost daily. And so the classic history is recurrent vomiting episodes. They're not sick in any other way. They're not losing weight. They don't have fever. They don't have malaise. They just vomit every day. And the classic symptom, and a lot of people kind of stumble upon this, is that the vomiting is relieved with hot showers. And so the way that the diagnosis is found is that the cannabis is not being used anymore and the symptoms resolve. So I just think this is useful information for everyone to know, and with what feels like an increased use of marijuana in young people and young adults, we are seeing more of this phenomenon. So I wanted to segue a little bit more into talking about addiction. I think that there are certain things that raise a concern for addiction. Unfortunately, a lot of these changes in behavior or mood or personality, hygiene, health, and school life also are markers for other things like depression, or is there a trauma or multiple traumas at home, or exposure to ACEs. But these are always things that should raise to the forefront of our minds. Could there be some substance abuse disorder going on in the patient in front of me or in the student in front of me? And one thing that I always say loudly and emphatically is just to really reiterate this message that addiction is not a weakness. It's not having willpower. It's a medical problem. And I would imagine that all of us here today feel exactly the same way. We view this as a medical problem, and we know addiction needs to be addressed in this way. But I try to share this message with parents and with teens and with teachers, because I think that much of the lay public really feels like addiction can be overcome by sheer will. But addiction is a common problem. Nearly 1 in 3 Americans suffer from addiction, and we all know it's not only certain neighborhoods, it's not only certain races, it's not only certain socioeconomic status that determines addiction. It crosses into all of our lives, and probably all of us know somebody closely that struggles with addiction. And it's all about the dopamine. We've been talking a lot about, or there's a lot of talk about dopamine in the lay press about it being a pleasure chemical, and I kind of do like that description. And I explain to young people that in nature, rewards usually only come with time and effort. So after all that time and effort, you get the reward, and then that helps to lay down a pathway so that you will do that behavior again, whether it's practice a piano piece until you get it perfectly and then you have a spectacular performance, or you practice a skill on your team and you become an athlete that can be depended upon to deliver the goal, or whatever that is. But addictive drugs and chemicals provide a shortcut in the brain, and it floods the brain with dopamine and other neurotransmitters, and these substances are much more efficient at releasing dopamine than natural rewards release dopamine. And so it's done more quickly and more reliably, and after that exposure, our brains will try to go after what it is that triggered that biochemical reward. And we were talking about how if you expose the adolescent brain to substances like this, since the brain is still under development until the early to mid-20s, those pathways are getting laid down and are becoming more efficient and being pruned. And so that is part of the reason why there is an increased risk of addiction later in life when children and adolescents are exposed to substances of abuse. So like with any medical disease, there are risk factors, and addiction is no different. Obviously, genetics plays a role. It does not account for 75 or 80% of addiction, but it probably accounts for somewhere on the order of 35 to 50% of risk for addiction. Psychological factors absolutely play a role as well, such as chronic stress, certain personality traits like impulsivity or sensation-seeking, depression, anxiety, or other depressive or psychiatric disorders. Environmental factors also play a role. We talk a lot about ACEs and children being exposed to adverse childhood experiences. So exposure to those things is a risk factor for addiction. Substance abuse in the family or amongst your peers is a risk factor. Easy access for sure. And then also popular culture references that encourage substance use. So then that takes us back to what we were talking about social media and the social aspects. And if your peer group uses a lot of substances, then it makes sense that you would use lots of substances, and then that becomes a risk factor for addiction. And then once again, just starting alcohol, nicotine, or any other drug exposure at an early age because of the brain being the last organ in the body to finish developing. So I love this cartoon, and it makes me laugh when I see it. And one thing that young people have said is, sometimes I'll use marijuana to relax from my stress. I have so much stress. And, if we think about what adults are saying about stress management, like, do we have healthy stress management techniques? Or how many times, say, does a parent come in after a hard day at work and say, oh my God, today was so hard, really stressful, I need a couple glasses of wine. We need to model for our youth healthy stress management behaviors, whether that be exercise or social interaction or something like that. But we have to be very careful about the messages that we pass on to our young people, where we are now telling them that a substance is used to diminish stress. But obviously sometimes it is more than just stress, and I always want young people and their parents as well to know that they're not alone. There's a high number of teens that have experienced a major depressive episode in the past year. 1 in 3 teens have experienced anxiety in the past year. And I think that a lot of these figures are not surprising to young people, although we're in this weird time where we talk about decreasing the stigma around mental health, and we see this weird thing where even though common things are common and depression and anxiety are common in young people, everyone feels alone with their depression and anxiety, and in particular, I think families feel alone when their child is struggling with something like this. I also like to emphasize that about half of all lifetime cases of mental illness begin by the age of 14. So, again, preaching to the choir, I'm sure, is we really need to diagnose these issues early in young people so that we can get them on their way to being treated, so that brain pathways that are dysfunctional thinking that are happening because of an untreated depression, for instance, don't get laid down to affect them for the rest of their life. Because we want young people to feel well mentally and physically, and it's just very important to think about these things at a young age. And of course, unfortunately, suicide is a leading cause of death in young people. Some headlines have suggested that suicide is the second leading cause of death in young people, increased from the third leading cause of death. And certainly access to firearms in the home or in the community is a definite contributor to that. This is a number that I think everybody should know and have in their phone. It's the Suicide Prevention Lifeline. I have shared this with young people for a long time, but actually I think that this next piece of information may actually be more useful for young people, at least in the U.S. Young people can text 741-741 and put home, and then they will get immediate support from a crisis counselor. And young people are so much more comfortable texting than talking on a phone or going onto their laptop and doing instant messaging or in a chat, that this may be very appealing information for them. So I do encourage you to share this if you have not already with the young people with whom you work. So I have a couple online resources for teens. There are a lot of wonderful online resources for different aspects of adolescent health. So if anybody is looking for something in particular, I would be happy to point you in a direction of something that appeals to me that I think is useful. Also, I had mentioned Stanford having the advertising website. I'd be happy to steer you in that direction if you think that material would be useful in your work, because it's really powerful to see the deliberate advertising strategy that has been applied time and again to different substances now being applied to e-cigarettes. And I do think that the advertising argument is one that teens pay attention to, and it makes them listen because it's a way of talking about the information that they've not really been exposed to. And this is my bio. And this is how you can reach me if you have any questions or I can help you with your work in any way. And that's where I'm going to stop. I think we have a few minutes for Q&A, but I hope that this has been informative for all of you, and I would love to help you in your work in any way that I can. So thank you.
Thank you, Dr. Offit. That was an amazing presentation. Thank you. At this time, we're going to open up to any questions anyone has. You can type your question in the Q&A box, or if you're on the phone, you can hit *6 to unmute your line. There is one question, Dr. Offit, from Matt. It says, considering our prolonged history in regulating tobacco, why was there, oh, I just lost the question. You know what, it keeps popping up. Why was there an apparent absence of awareness of the potential consequences of this technology?
I'll say what I think. So I think that a large part of that is because when e-cigarette makers got into this field, part of the intent was as a device to help with smoking cessation. So in terms of the regulatory environment, the FDA did have some specific requirements that e-cigarette companies had to use to be able to promote for smoking cessation. That also was a bit spotty at the outset, I think largely because there just hadn't been anything like this before, and I think that if I'm remembering this correctly, the e-cigarette companies did not want to be considered something like a nicotine patch or go that route, because they would then have to do trials, to show efficacy. So there had been resistance from the companies in that regard. And a lot of the conversation had been about providing options to help tobacco smokers stop smoking tobacco. Because I think in terms of smoking cessation, there's strong arguments to be made that more tools are better, although there is a lot of data now that's showing that people that switch to electronic devices often don't have better rates of quitting than not being exposed to this. So I think that is one piece. I think that although the e-cigarettes have been percolating along for a while, the development of JUUL was appealing to young people in so many ways, and it just took off like wildfire. And so what was a trend already in making, it was like gasoline got poured onto that, and it really took off because it's very appealing in terms of design. The people that designed JUUL were smokers who were interested in the design and like Silicon Valley type space, and so they wanted to design something specifically that would replace cigarettes. And the tobacco companies recognize they want to hold on to their market, and they're actually buying the e-cigarette companies because they feel like they need to maintain their market with the trends being shifted off of tobacco smoking into e-cigarette smoking.
That's great. Another question is, someone asked if you could please repeat the number for the teens to call.
Okay, so I'll back up here on the slides for those of you that are online. So the text number, you text 741-741, and then you text home. So they put home into the text bubble. And then the Suicide Prevention Lifeline is 1-800-273-TALK, which is 8255. And also another way to access the support there is to go to suicidepreventionlifeline.org, and you can do a chat in real time online as well.
Great. Another question is, how has the feedback or response been from the young people after you provide them with the data and information?
I think I try to incorporate a lot of humor into the presentation just so that it doesn't feel like another long lecture. But I think the piece that has resonated the most, where I have noticed them kind of sit up and pay attention, is putting together an argument about the advertising. And in the presentation that I've done for young people, I have a lot more examples because I really want them to kind of I want to appeal to their desire to not do what adults want them to do, to have them understand that there are boardrooms filled with adults strategizing how to get teens to do what they want them to do, and I'd come at it from that angle. I think that the safety piece is useful, but it's really hard to win on that argument, so I think mentioning it and including it along with everything else is important. But the advertising piece actually resonated pretty dramatically with them, in my experience, at least with the groups that I've spoken with.
That's great. Another question is, as consumers, is there anything that we can do to help, speak to those gas stations and those convenience stores in regarding not having as much access to these students? Because many times you find these gas stations down the street from these schools, so it makes it very difficult.
I don't have any specific recommendations or any resources that I could share to help with that, but I certainly think since gas stations function as part of our community, I wonder if in many ways they're not fully aware of products, that they're selling products to young people. They may not care, for sure, but I perhaps even just sharing that there is a concern and it is a significant health risk, especially in young people, and just asking them to please not sell to them. I suppose that could help, but I don't have anything really specific in that regard. I do think it's a gap, for sure.
Great. If anyone doesn't have any more questions, Dr. Turchi?
Great, thank you. And I just want to say again, Dr. Offit, that was truly a fantastic webinar on a topic that I think we can all attest to is on the top of our minds and in our practice. So thank you so much. We want to thank you for your excellent presentation, and I also want to acknowledge the Pennsylvania Department of Health for the funding that made this webinar possible. This concludes our webinar. Thank you, everyone.
Thank you.